Okay, Dr. Weber is treating the patients for fat obesity.
First, we of course have to carefully disinfect the areas. So carefully disinfection in the area where you want to inject, and really you can work in every area that seems to be suitable. We use up to 6 optic fibers in the abdominal region. Here, where we don't have much problems in the upper abdomen, we only will focus on the treatment, on the irradiation in the lower abdomen.
تو کلینیک لیزر اروپا هستیم در حال درمان بیمار مبتلا به چاقی. این بیمار جلسه سومش هست، به صورت مشهودی کاهش سایز داشته و به دلیل رضایتی که داشته برای ادامه درمانش اومده. آقای دکتر مایکل وبر، رئیس آکادمی لیزر اروپا و رئیس کلینیک یوروپیان امریکن لیزر کلینیک در حال درمان بیمار هستن. دارن دیسینفکشن انجام میدن تا کارو شروع کنن.
To reduce the local pain, you may work with local activation of the area. This not only reduces the pain, but additionally loosens up the tissue. And when we will insert the normal saline and the optic fiber, we get much better irradiation in the tissue, and we get a better enlargement of the spread of photons in the tissue as well. So it's a double effect, reducing the pain, loosening the tissue. So superficially you anesthetize the tissue with lidocaine.
کی بردش؟ نداره.
Another method that even reduce further the pain is once again activation of the tissue.
کدوم مریض؟ به کدومش؟ همین؟ وای
We should have, of course, everything ready. The normal saline, we need that we get a good flow of the photons into the tissue, the sterile syringes with the needles, and of course, most important, the single-use catheters with the single-use optic fibers. Can you please give me a hand? Yes, we can start out with the depending on the size of the abdomen, you may use 4 centimeters, you may use 6 centimeters needles. You rarely need more than 6 centimeters of the needles. Fitting to the needle, we have the single-used optic fiber. And very important is that this goes with each other. The tip of the optic fiber must be just outside of the insertion needle. By this, we can guarantee the best possible flow of photons into the irradiated tissue. So we have the 4 needles for insertion and the 4 according single-use optic fibers. Can you then please open the syringes? Thank you. Then we need the normal saline, 5 to 6 to 8 ml is good for the injection. And of course, all these preparation should be performed under sterile conditions. So now we have the 4 syringes with a little bit more than 5 ml per syringe each. We still can pretty good visualize the areas that were anesthetized before. And then we have to decide in which depth we have to inject. If we see this example, 6 centimeter, if we would go directly perpendicular, we would of course penetrate into the peritoneum and into the area of the gut. So we have to insert perpendicular to make sure that we are within the abdominal fatty layers. By stretching, evaluating, we fix the tissue and then can insert. Take a deep breath. You actually may directly insert the normal saline. What I prefer to insert on each side and then continue with the maneuver. Stretch again, take a deep breath. Then we take the normal saline. Everything is connected by Luer lock. You may feel a little bit of distension now at the abdomen. We go to the next needle. We Luer lock again, do short aspiration, nothing comes back. Then we can insert the 5 ml of the normal saline. And you see the patient is happy and doesn't feel anything. Then you invert the single-use sterile optic fiber. And the first side is done. To make sure that the area you want to insert is still properly anesthetized, you can just try. Do you feel any discomfort?
Yeah.
It's okay.
So there was some pain.
Little pain.
This was fine. There?
No, it's okay.
Okay. So we know these and these are the size and they are proper anesthetized. There we can insert the needles. Deep breath. And another deep breath.
Oh.
Lure lock and insert a little bit more than 5 ml. Sometimes this injection causes some discomfort. And then likewise on the other side we will insert the optic fibers. You see it's easily pushed forward. And basically now we can start with the irradiation. I always recommend to briefly fix the optic fibers that nothing can be moved during the treatment. So according to the areas you want to irradiate, according to the numbers of optic fibers available to you, you insert in this case 4, but up to 6 needles on each side. The more needles you insert, the more pronounced your effect will be in the upcoming days. The infrared and red light will send the adipocytes, the fat cells, into programmed cell death and will have a marked effect on the irradiated areas. You may use this over the abdomen, if necessary, in the upper abdomen. Of course, be always very careful about the liver. You may use it in the upper leg, in the thigh region, or even in the upper arm. We now will connect to the optic, to the lasers, the optic fibers to the laser. So after you fix the single-use optic fiber, it's very easy to connect to the laser device. Just press, and then you get good connection to the optic fibers. The best penetration you get with red light, the most visible, I must say. The better penetration you get with non-visible infrared light, and the absorption peak for the fatty tissue is the infrared light. There are two suitable wavelengths for irradiation of the abdominal tissues. The best is the non-visible near-infrared light. It's visible by most of the smartphones. The other wavelengths, bright irradiation, is the red light irradiation. They can be combined for the treatment. Tip of the needle.
Yeah.
It's not here, not here. So it really reflects we are in the center of the joint space.
Wonderful. Dr. Weber, never yellow, green, blue, and red
So
cannot penetrate.
basically there are two colors, let's call it colors, wavelengths. Just visible red light can give good penetration from outside into the tissue, into the bone, into the joint. And even if you puncture the joint, you see red light gives the best irradiation. Infrared would do similar, would do likewise. All the other colors, blue light, green light, yellow light, would never penetrate deep into the tissue and would never reflect such a shining effect onto the irradiated joint.